3.
Schizophrenia. Some background information. Schizophrenia is a disorder that affects the way the brain perceives things in our everyday lives. During the 19th century, many European psychiatrists were seeing unknown symptoms in patients that they didn't have a known disease at the time. Some psychiatrists had different views on schizophrenia. Emil Kraepelin, he combined the unknown causes and called it dementia praecox. He believed many of these clinical cases had similar symptoms that resulted in mental and behavioral decline. Even though he observed many clinical cases, he never came out with a list of symptoms for dementia praecox. Overall, Kraepelin believed that neuropathology, physiology, and biological chemistry of the brain caused this disease to form. Eugene Buer introduced the difference between accessory and basic symptoms. He stated that the appearance of the basic symptoms are a more accurate way of diagnosing schizophrenia. Basic symptoms included a withdrawal from reality as well as thought and speech deprivations, and accessory symptoms included delusions and hallucinations. Carl Leonard created a spectrum of schizophrenia that was substantially different from Kraepelin and Buer. He split the non-affective psychosis into 3 groups: systematic, unsystematic, and cycloid, and claimed each of these had different categorical disease statuses. Systematic schizophrenics are presumed to acquire the disease because of early failure of social learning or maternal obstetrics. Unsystematic schizophrenics are considered genetic, and hereditary factors are known to have a secondary role in cycloid schizophrenics. Theories of causes. There is not a known cause for schizophrenia, but researchers believe a mixture of genetics, brain chemistry, and surroundings are factors to this disorder. Neurotransmitters such as dopamine and glutamate are thought to aid in schizophrenia. Researchers believe that schizophrenia is a brain disease. The diagnosis. In males, signs begin in their late teen years or early 20s. In females, signs develop between early 20s and early 30s. There is not a clinical test for this disease, so a psychotherapist will evaluate the patient to rule out any other psychological or physical conditions. Positive symptoms include a break with reality, hallucinations, altered perceptions, delusions, or evidence of thought disorder or movement disorder. Hallucinating includes hearing voices or visualizing things that truly are not there. There are 3 common types of delusions, including delusions of persecution, grandeur, and reference. Delusions of persecution include strong beliefs that someone or something is trying to harm you physically or emotionally. Delusions of grandeur involve the thought that you are famous or an extremely important person. Delusions of reference is the idea that things are referring to you when they are not. Thought insertion is another common positive symptom. This means they have the belief that their thoughts are not their own. Another form of this is thought broadcasting, which is the belief that everyone can hear your own thoughts. Negative symptoms include anhedonia, avolition, social withdrawal, apathy, difficulty paying attention, affective flattening, and algia. Okay, I'm just going to keep going.
Which word?
This word.
Anhedonia?
Anhedonia is the inability
Never heard that one before.
to
I learned something today.
experience pleasure. Abolition is having a lack of motivation and the inability to carry out plans or goals. Social withdrawal is not wanting to socialize with people or go out to any public places. Apathy is lacking concern for yourself or others, and this can affect personal hygiene. Affective flattening is the absence of emotions and facial and bodily expressions. Alogia is reduced speech and fragmented sentences while speaking. There's not a known cure for schizophrenia, but there are ways to manage it. Treatment for schizophrenia varies between every patient depending on how symptoms are or the kinds of symptoms. There are different treatment options. Antipsychotics are a common treatment plan, but by affecting the neurotransmitter dopamine, these medications can help with symptoms such as hallucinations and delusions. But these medications can cause serious side effects, so many patients decide not to use them. Along with medication, psychosocial interventions are also important for a treatment plan. Individual therapy is important for learning how to manage stress and to recognize early warning signs of a relapse. Social skills training helps with communication skills and resuming everyday activities.